Hello, I'm Dr. Frances Pitsillis. Endometriosis affects around 10% of women and is a common debilitating condition. It's a condition where the cells that would normally reside in the lining of the uterus are found in other places. When they're found in the lining of the uterus, in the muscle of the uterus, instead of more superficial, it's called adenomyosis. But when it's found in other areas like ovaries, fallopian tubes, vagina, cervix, in the pelvic ligaments, rectum, vagina, and a whole lot of other places, they call it endometriosis. The classic lesion of endometriosis is the so-called chocolate cyst, which expands as the woman gets ready to and then bleeds, and it causes a lot of pain through the stretching. There are some odd places where you can also have it as well, and symptoms can include painful periods, which is the most common, pelvic pain, which can occur commonly, painful intercourse, lower abdominal or back pain, painful bowel movements, especially during a period, painful urination, especially during a period, pain with exercise, and infertility. Diagnosing this condition can sometimes be delayed because people don't always think of it, particularly if the symptoms are not classic. And it can mimic other conditions like inflamed pelvis, vaginismus, which is vaginal spasm, tumours of the bowel, uterus or ovary, constipation, muscular pain, irritable bowel, irritable bladder, ovarian cysts, ectopic pregnancy, and even it can mimic a urinary tract infection and acute appendicitis. We don't really know what causes it, but there are theories. One cause is that of, or one theory is that of retrograde menstruation, which means that the blood goes backwards out through the fallopian tubes. But a lot of normal women get this, so we're not sure about that. Metaplasia is another theory, and this is where the original cells in the area of the pelvis may change into different types of cells that would have normally lined the endometrium. What we do know, however, is that it runs in families. It occurs more if you start your periods young, if you have short menstrual cycles, if your flow goes for longer than 7 days, if you have heavy periods, if you've had fewer births, if you've delayed childbearing, if there are defects in the uterus and fallopian tubes, and for some reason an iron deficiency can contribute. And we do know that the immune system is involved because studies have shown that there are more inflammatory messengers like IL-8, TNF-alpha and IL-10 in these patients. Women with endometriosis have been found to have antibodies attacking the endometrial tissue. And they've also been found to have decreased T cell and natural killer cell responsiveness. Now, not surprisingly, these women have more risk of autoimmune diseases like lupus, rheumatoid arthritis and multiple sclerosis because their immune system is out of balance. And this condition may be associated with an autoimmune-related recurrent miscarriage. Not only that, these women also get more asthma, allergy and eczema. So we've got autoimmune and asthma, allergy and eczema. And we also know that they also have a slower or underactive thyroid commonly. And all of these things, when someone comes to me with various symptoms, if they have a lot of other things like this happening around it, that will help me become suspicious that they may have endometriosis. What's also very important is that because of the immune problems, that these women have a higher risk of ovarian cancer and Hodgkin's lymphoma. So what other influences? Well, we know that diet has a role. Women who have a lot more green vegetables don't get it as much, and women who have more red meat do get it a lot more. Environmental factors like bisphenol A that you find inside tins, parabens, Phthalates, pesticides, dioxins, PCBs, solvents, and formaldehyde all have a role. What we do know is that there's some problem with the way estrogens are converted. We do know that the enzyme to convert estradiol, a reasonable estrogen, to a less potent estrogen called estriol, that enzyme isn't there. And we also think that these patients make more excessive estrogens, which then possibly increases the risk of inflammation and then creates a vicious cycle for them. How do we diagnose it? Well, in the end, it's got to be a laparoscopy and biopsy, which can be done at a time when a therapeutic treatment can be performed during the surgery. Scans can be of some use. There is a blood test that can monitor the activity of the disease, and it's called CA125. The treatment goals of this condition is to reduce pain, inflammation, and disability. We want to shrink the endometriosis lesions. We want to support the immune system and reduce damage to tissues. And if at all possible, we want to support fertility. About 1/3 of women will find that their condition will spontaneously resolve, but the rest can have a variable course. The first-line approach with medical manipulation is by using the contraceptive pill and synthetic hormones and analogues to hormones to try and control the cycle or even eradicate the cycle. And that can also include something called GnRH inhibitors, and these are the drugs that switch off the pituitary messaging to the ovaries so that you go through a menopause-like state. Obviously, there are going to be the side effects of some of these drugs. Bioidentical micronized progesterone can be used to lessen the pain and reduce the heaviness of the period. And it does this by reducing the uterine contractions. It can be used 3 weeks on, 1 week off. Non-steroidal anti-inflammatory drugs can also be useful. When it comes to surgery, there are 2 usual situations. First, where fertility needs to improve, and secondly, where removal of diseased tissues can be helpful. When it comes to nutritional support, the sorts of things that can be done would be to reduce saturated animal fat because that increases inflammation. Take soy-based foods if you don't react to them, because that increases genistein and daidzein, which has a very good effect on the ovary. Having lots of fruit and vegetables will give you natural antioxidants called polyphenols. Have fish oil because it's anti-inflammatory. Omega-6 oils like borage oil and evening primrose oil and flaxseed oil can be helpful. And more of the cruciferous vegetables which make estrogens healthier, and these include kale, cabbage, broccoli, Brussels sprouts, and cauliflower. It may be worth looking at antioxidant status like vitamin C and vitamin E. The natural things that can be added to this include anti-inflammatory herbs like curcumin, quercetin, boswellia, and ginger, and even green tea. And a natural substance derived from brassica vegetables called indole-3-carbinol, and its metabolite called diindole methane, or DIM, can be given as a capsule, and that makes the estrogens healthier as well. So as you can see, it affects 1 in 10 women, can be very disabling, can affect fertility, and commonly gives pelvic pain. It's something that requires medical management, but if we can bring in some dietary and natural therapies, herbs and micronized progesterone, we can have a better effect on controlling this disabling condition.